Hello, Senior Care Partners PACE, and welcome back to another Monday Marketing. I've got a couple of reminders for you before I get into this week's education topic. The first thing is to let you know that our limited edition t-shirts, the one that I'm wearing here, they're in. They just came in on Friday of last week, so we need to sort them out, and then we'll get them out to your centers hopefully this week. You'll get an email letting you know that they're in and that you can pick them up from the reception desk or designated area at your center. So they are in. For those of you that were not able to order one of the t-shirts and are interested, I do have a few extra limited quantities, but reach out to me. They'd be $12 each, and a portion of that goes to our Fulfill a Dream campaign. Speaking of that, by ordering these t-shirts, we were able to raise a little over $75 to go to the Fulfill a Dream fund. So just by that small 50-cent donation from each t-shirt, we were able to designate some money to help our participants in other ways. So thank you for being so generous, and get ready to rock your new t-shirts. Another recommendation, or a reminder, I should say, is just on our continued efforts for employees and participants to help initiate referrals. You know our program, and you know the people that need our help, so we appreciate it when you're sharing that with other people. And I've mentioned before that I have a special coffee mug that I'm going to get to you, and those are being designed and will be ordered soon. So I know I owe a few of you those coffee mugs, and they are coming your way soon. So thank you for your patience with that. I've also asked you over the last couple of weeks to be engaging on our social media, especially with our special Wood TV 8 West a video that we had done, an interview that we had done, and that's still on our social media pages. I was hoping to get to 100 shares on our Facebook page. I think we're up to about 76 of those at last check, so we still have some opportunities. If you haven't gone on Facebook to share that 8 West video, I'd appreciate it. Well, let's get into our education topic for this week. For today's education topic, I want to give everyone an update regarding Medicaid eligibility for our program. Now, this is different than the eligibility criteria for the PACE program. Medicaid eligibility is a separate topic for us to discuss. You don't have to be on Medicaid to be a participant with Senior Care Partners PACE or in a PACE program. That being said, in our organization and in most PACE organizations, 99% of participants are eligible for long-term Medicaid. So it's important for all of us to know some of the updates and what some of that criteria looks like for Medicaid. And as you see this resource here, and I'll put a link to this page in with the video here in the email with the video. But the couple of numbers I want to mention here, one is the gross monthly income requirement for long-term Medicaid. That is $2,901 per month. That's gross monthly income before taxes, irregardless of expenses that somebody might have. This is every month how much money is coming into them. And this is a hard cap. Somebody cannot be over that $2,901 and be eligible for Medicaid. The update that I want to give you, though, is regarding the assets to be eligible for Medicaid. For approximately the past 50 years, that asset limit has been $2,000. $2,000 in assets that somebody can have. Money in the bank, money in their savings account, a small life insurance policy. Those would all be considered an asset, and they could only have $2,000 in those assets. One house, one car are exemptions. Those are not considered or counted towards those $2,000. However, just this year, just this month here in February, that asset limit has increased to $9,660. So the first change to this asset limit in 50 years. This now means that somebody with $9,660 or less in assets would be eligible or could be eligible for Medicaid. And we found in the past that somebody, again, having $5,000 or $7,000, in their savings account that was preventing them to be eligible for Medicaid, that money was there. Oftentimes they were, saving for a worst case scenario. What if a car dies and they need to replace the car or have a down payment? What if they're stuck with an unexpected, bill for that? having $5,000 to $7,000 in their opinion was not a qualifier, or considering them, well off. They were still, living paycheck to paycheck in many cases. They just had that small reserve set aside. And now with this increase in the asset limit, they'd be able to enroll without having to exhaust that amount first. Another issue that prevented somebody from doing that, I mentioned, was a life insurance policy. Somebody having a small $5,000, $7,000 life insurance policy to help kind of pay for things upon their passing, maybe the funeral expenses that they had that life insurance policy, or wanting to have just a little something to pass on to a family member. That was preventing them from being eligible for Medicaid. So we're very encouraged by this. We think this is going to help us help more people and help them sooner with this process. But I wanted to share this with the organization in case you've heard somebody, in the past saying, well, I wasn't eligible because I had a little too much money in the bank, in a savings account or a life insurance policy. We'd like to revisit that conversation, with them. The more you know, the more we can help. And I wanted to pass this along. January and February have been a very strong months for us in terms of referrals and for enrollments going forward. Thank you for the work that you've done on that, helping generate referrals, whether that's wearing logo wear, whether that's talking to a neighbor, participating on social media, encouraging participants to tell their friends, about us. Thank you for that work that you've done to help us with our overall referrals. I've mentioned before, it takes about 95 referrals every month in order for us to enroll 18 to 20 new participants each month. So thank you for the work you're doing in that area. And thank you for the work that you're doing to help us enroll new participants. Many of you are probably aware that for our March enrollments, we have a big number, coming in of new participants that we're going to enroll. And I know that's a lot of work for all of us. And it's amazing work and amazing help that we're going to be able to give more people in our community, not just the participants, but their extended family, their extended caregivers and contact spheres, and our community partners. When we help more people in our community, that means we have less people going to the emergency room when that's where they don't need to be. We have less people using burdening caregivers, with that. We have less, individuals needing other resources in the community because we're able to help them. So thank you for that amazing work that you're doing every day, every week to support our community and to support each other. Have an amazing week.